And I'm curious if we could just, if I could lastly ask you about estradiol use in breast cancer treatment, because I know that when we look at even in the WHI trial, the estrogen only arm, even though that was Premarin, and so that was synthetic estrogen, showed a decrease in the incidence of breast cancer, right? And so, am I right about that?
So that was conjugated equine
Yeah.
estrogen. There were 5,000 people that got the placebo, 5,000 people that got the drug,
Mhm.
and they did not see an increase in breast cancer with conjugated equine estrogen. However, this is my pet peeve: is estrogen
Yeah.
only with the uterus. In the nurses' health study that had 122,000
Mhm.
people, so that was 5,000, 122,000 people, the longer you took estrogen only, the higher increased risk of breast cancer. And it was 20, 30, 40% increase.
Mhm.
In the E3 EPIC cohort that had 80,000 people, again, observational,
Mhm.
not placebo controlled, there was an increase in breast cancer with estrogen only. Relative
Right.
risk was 1.3. So it really bothers me when they say there's no increase with estrogen
Mhm.
only, because there's one randomized placebo
Mhm.
controlled trial with only 5,000 people for 5 years,
Mhm.
where you have these other larger nurses' health study is massive,
Mhm.
right?
Mhm.
So anyway, reframing that,
Yeah.
the question is different about estrogen after breast cancer. So it's very controversial because
Mhm.
unfortunately, no oncologist will ever sign off on it. So what do we know? We know
Yeah.
that even just recently, there were more articles that looked at vaginal preparations
Mhm.
in vaginal estradiol, vaginal DHA after breast cancer. There were no concerns. There was a study done in either Sweden or Switzerland. Now I should know which S country. It was in 2022,
Right.
just published. Breast cancer survivors got systemic hormone therapy as
Mhm.
well as vaginal hormone therapy,
Mhm.
and there were no increased risk
Mhm.
of breast cancer with that.